the Christ child coming. And it's also the time when we are in expectation of the second coming. Okay. So in some churches, they light candles for Advent on each Sunday of Advent. So the first one is the candle of hope. The second one is a candle of love. The third one is a candle of joy. And when you get to the fourth, which is what this one is, the last Sunday before Christmas, it's the candle of peace. And our world's not always a peaceful world. People hurt other people. Countries are at war. People don't take care of our world. They yell and scream at other people. But God promises peace. Amen. And during Advent, we pray that we, as well as all people, will seek God's peace. So my prayer today, if you bow your heads, dear God, thank you for your son, Jesus. Thank you for those in our world today who seek to act for peace. Help us to look for ways to be peacemakers at home, at church, at work, and at school. Amen. All right, so I said the word, I'm going to say it again, gastroesophageal reflux disease. They call it GERD, G-E-R-D, okay? And I think we all, to a certain extent, have experienced GERD, because you even see GERD in little babies, like newborns. And they say that the kids reflux, and it makes them fussy babies, and it makes them unable to gain weight. And so it's something that happens across the spectrum. So some other words for it are heartburn, gas, bloating, indigestion. There's probably some more that you guys can think of. So what is it? It's a digestive disorder that affects the ring of muscle that's between the esophagus, which is your swallowing tube, and your stomach. The ring is called the lower esophageal sphincter. So, sphincter is something that squeezes, okay? If you have it, or if you have the disorder, you may get heartburn or acid indigestion. Some people have it because of a condition called a hiatal hernia. And a hiatal hernia is where that sphincter is loose, so your stomach kind of slips up and down instead of it staying stable like it should. In most cases, you can ease the symptoms with diet and lifestyle changes, but some people need medication or even surgery. So in normal digestion, the lower esophageal sphincter opens to allow food into your stomach. Then it closes to stop the food and acid and the stomach juices from flowing back up, okay? Reflux, it happens when that sphincter is weak or it relaxes when it's not supposed to. And that lets the stomach contents flow up into the esophagus, and then you feel the acid. Because when it gets into your esophagus, it can get in your mouth, and then you feel the nasty stuff. Okay. So some symptoms, a burning sensation in your chest. We call that heartburn, usually after eating. It might be worse at night. Chest pain, difficulty swallowing, regurgitation of food or sour liquid. That means throwing up a little in your mouth. Sensation of a lump in your throat. They call that globus sensation. And then if you have the nighttime kind of acid reflux, you might also experience a chronic cough. So the cough isn't always from the lungs. Sometimes it's because of reflux. You can get laryngitis. That means you lose your voice. New or worsening asthma, or disrupted sleep, okay? Sometimes it's not reflux. I have to say this, probably more than once. So you're going to seek immediate medical care. If you have these symptoms, you have chest pain, and you have some associated shortness of breath or jaw or arm pain, because those might be signs or symptoms of a heart attack. And they look amazingly the same. So you just have to know that if it's just reflux, you're not going to feel it in your jaw, you're not going to feel it in your arm, and you're not going to be short of breath, okay? And then just make an appointment with your doctor if you're just experiencing the frequent symptoms, or you've been taking the over-counter medications and you're still getting heartburn more than twice a week. Risk factors for this condition: obesity. Have y'all noticed obesity is just like a risk factor for everything? It's everything. Bulging at the top of your stomach up into your diaphragm. That's how they referring to the hiatal hernia. I like my definition better, where it slips up and down. Okay. Pregnancy. Scleroderma, which is a connective tissue disorder where the organs are hardened, so they don't function the same. Delayed stomach emptying. Sometimes people with diabetes get that. They call it gastroparesis. And then things that can aggravate the reflux are smoking, eating large meals or eating late at night, eating certain foods that trigger, so like fatty foods, fried foods, drinking certain beverages such as alcohol or coffee, and taking certain medications. Aspirin would be an example. And that doesn't mean that you can't do any of these things, but it does mean that if you're having reflux and you're having it frequently, you might want to modify what you're doing. Complications of reflux over time: if you get chronic inflammation in your esophagus, it can narrow. That's called a stricture, and that's because the stomach acid is coming up so much that it's allowing scar tissue to form. And so that narrows the food pathway, and so then you have problems swallowing. You can get an ulcer. It's an open sore, and that's the same thing. Stomach acid is acid. It wears away at tissue and can cause an open sore. And that can bleed and cause pain and make swallowing difficult. And then the one that the doctors worry about the most is called Barrett's esophagus. That's when you have precancerous changes in your esophagus, and it's also just damage from the acid. But it changes the architecture of the tissue that lines your esophagus, and that's associated with an increased risk of esophageal cancer. So how do we know we have this? In general, you can diagnose GERD with a history and physicals, and your doctor can say, yeah, that's GERD, and put you on something. But sometimes you have to confirm the diagnosis, especially if you think that you're dealing with the Barrett's esophagus, Barrett's esophagus or a stricture. Then you need to get upper endoscopy. That's called EGD. And that's esophago, that's the esophagus, gastro, that's stomach, duodenoscopy. The duodenum is the next part of the intestine after the stomach. And so the doctor inserts a thin, flexible tube with a light and a camera down your throat. And remember, we talked about the other tube that goes the other way. This is the EGD. This is the one that goes from above. And it looks at the inside of your esophagus and your stomach. Okay? There's also something called a pH probe test, where you just get a monitor in your esophagus that it identifies how long acid stays in there, or if there's acid in there. That's the one that they use on children too, and infants, to diagnose. And the monitor could be like a little catheter that's threaded through the nose into the esophagus. And sometimes it's a clip placed during endoscopy. And then they have esophageal manometry. That's more for if you're having the difficulty swallowing. So it will measure the muscle contractions that you have when you swallow, and the coordination of the muscles of the esophagus. And then sometimes you just need an x-ray of your upper digestive system, but not a plain x-ray. It's an x-ray after you drink some barium, so that the radiologist can see how things pass through. So it'll show, so it's more of a movie than a picture. So they'll show how it's passed through, okay? And sometimes that's called a barium swallow. Treatment. So in general, over-the-counter medications tend to be very effective. So we have, first off, we have antacids that neutralize the stomach acid. So you have the acid there, you put something in there to make it neutral. Because you know you have acid and base, neutral is when they offset each other. So antacids like Mylanta and Rolaids and Tums, they can provide quick relief. But if your esophagus is already inflamed, they're not going to heal the inflamed esophagus. They're just going to provide some quick relief. And then overuse of some of the antacids can cause diarrhea and sometimes kidney problems. So that goes back to if you're having the symptoms more than twice a week, you should probably see your doctor and see if there's something else. Then there's medications that reduce the production of acid. So those are called H2 blockers, okay? And they include cimetidine and famotidine. So those are like Tagamet and Pepcid, and Axid is one also. And it used to be Zantac, but that was taken off the market. Though I did see a commercial recently for Zantac, so I don't know what's going on. Maybe they revamped it. I'd stay away from it for now. And then they have stronger versions that are available by prescription. And then there's medications that block acid production and heal the esophagus. And so those medications are called proton pump inhibitors, okay? And so they're stronger than the other ones, the H2 receptor blockers, and they allow time for the damaged tissue to heal. So those are over-the-counter ones are Prevacid, Prilosec, Nexium, and then there's some prescription strength ones for when those are not working as well, okay? There's also medicine that can strengthen the lower esophageal sphincter if that's the primary problem, and one that's used for that is called Baclofen. It's also a muscle relaxant. And so it just decreases the frequency of the relaxations of that sphincter. But the Baclofen can cause nausea and fatigue, so it's a trade-off. So say you've tried all of that. You tried the over-the-counter medicines, you tried the prescription medications, and you're still refluxing and it's affecting your life and you're losing weight because you're not able to eat properly. There's procedures that could be done. One is called fundoplication. So basically the surgeon wraps the top of your stomach around that sphincter. So that's going to tighten it up, right? And so it tightens the muscle and it prevents reflux. It's minimally invasive, it's laparoscopic. I remember sitting in on multiple of these while I was a student, a medical student. They do come loose over time. But it's one of the things that they do. And then nowadays there's something called a Lynx device that it's a ring of tiny magnetic beads that they wrap around that area. So what about, can't we do something without medicine? Because that's always the question. Doctor, why do you always want to give some medicine? And I say, because that's what they train us on. They train us on medication. So if we want to find out about lifestyle and alternatives and all of that, we're on our own. And it doesn't always count towards continuing medical education. You just have to do it yourself. So lifestyle changes may help reduce the frequency of acid reflux. So, and keep in mind, that's what I said, because if you have that damage, then changing the way you eat is not going to do it alone. So maintain a healthy weight. We're back to that again. Excess pounds put pressure on your abdomen. It pushes your stomach and causes the acid to reflux into your esophagus. Stop smoking, because smoking also decreases the sphincter's ability to function properly. You can elevate the head of your bed. So if you're one who experiences heartburn while you're trying to sleep, You can place wood or cement blocks or whatever under the bed so that the head end is raised, okay? If you can't elevate your bed, you can insert a wedge between your mattress and the box spring, whatever you have to do. They found that raising your head with additional pillows isn't effective. So you actually have to raise the bed. Don't lie down after a meal. Wait at least 3 hours after eating before lying down or going to bed. Eat food slowly and chew thoroughly. So you put down your fork after every bite. That's one way to eat slow. And then you pick it up again when you've chewed and swallowed that bite. Try it. Avoid foods and drinks that trigger reflux. So common triggers, again, fatty or fried foods, tomato sauce, alcohol, chocolate, mint. I think mint, it's ironic because a lot of people would say, I feel sick to my stomach, I'm going to suck on a mint. Or I'm going to chew some peppermint gum or something like that. And actually they're probably exacerbating it a little bit. But okay, so mint, garlic, onion, and caffeine. So that's pretty much my whole diet. Right there. And avoid tight-fitting clothing. Yeah. So if the clothes fit tight around your waist, it puts pressure on your abdomen and that sphincter. So that's the only reason. So no alternative medicine therapies have been proven to treat GERD or reverse the damage to the esophagus. But there's some herbal remedies that people use. So I always put them out there for you guys. Licorice and chamomile are sometimes used to ease the symptoms. And then relaxation therapies. So they say techniques to calm stress and anxiety can reduce the signs and symptoms of the gastroesophageal reflux disease. So here's the outlook. So even though that GERD can limit your daily activities, it's rarely life-threatening. So that goes back to recognizing that is it just GERD, or do I have this, am I all sweaty and short of breath and my arm is hurting while I'm having this? Because then that's the ER, okay? But if it's just GERD, it's rarely life-threatening. So if you understand the causes and you get proper treatment, then you should feel better. So the heartburn triggers of diet, the number of foods and drinks that we've already talked about. And I don't think I added any, I might not have said citrus fruits and products. So that's also important because it's acid. So lemons, oranges, orange juice. And remember that tea, regular old black tea has caffeine, because a lot of people want to drink some tea to soothe their stomach as well. And the caffeine part is going to irritate things, and soda. And that is what I have this Sunday. Any questions? Yes, ma'am.
Does stress affect it?
It does. It does, because it increases the acid in your stomach. When you're stressed, you're emitting more acid. So if you have the cure to get rid of stress, can you let me know? And then we'll make money together. All right. Yes, sir.
You said earlier that you should eat slower
Mm-hmm.
and put down your fork. How many times should you chew your food before you swallow? Ideally.
I'm not sure. I would say chew it till it's gone. You know, because some people, you know, me chewing 10 times, it might have been gone, but I'm just chewing because somebody said to chew 10 times. You know what I mean? So I would just say, you know, but you got to chew it until it's gone, and chew it slowly, and not just try to inhale it. I'm guilty. I'm a fast eater, and I passed that on to one of my kids, and we're working on it.
I went back to
Wednesday for a total knee replacement surgery.
Man.
And I'd like for everyone to pray for me. And this is the second one, but I had to go the first one in 2016 because I'm right knee. And this is also my 10th surgery, so I'm not afraid of the surgery. I just don't want to go in the hospital and all that COVID.
Yeah. Amen.
Can you get, I think you went over, can you get, like you have a real heartburn, do they sometimes get confused with a heart attack? Because sometimes you get to the hospital and then they say, oh, it's just heartburn.
Yeah, but it's important to rule it out because heartburn's not going to kill you, but a heart attack will. So if you don't know, then you go and you get it checked out. And who cares what they say if they say it's just heartburn. It's not just heartburn, it's just not a heart attack. That's the way you should think of it. Yes, sir.
I heard that when you like chew gum and stuff like that, it triggers the same acid to come out as if you was eating food, and that can cause problems.
I know that if you chew peppermint gum, it does. I don't know if that's true with all gum, but it makes sense that your digestive process starts when you chew gum, but that doesn't necessarily mean that you're releasing the same amount of acid as if you were eating like tomatoes or citrus fruits or something like that, that triggers that response.
So your body adjusts for what you eat then?
Yes.
Okay.
Yeah, because you know, we don't get many reflux symptoms from like eating a piece of bread. No. Yes?
If you take a medications like Prilosec or Nexium, and the next day you feel like you have a lump in your throat, what causes that?
So the lump in the throat is usually caused by the reflux itself. So if you're taking the medicine regularly and you're still feeling the lump in your throat, then it's not working. Yes?
A lot of children now are being born with acid reflux. So kind of what causes that?
It's the same thing. It's that lower esophageal sphincter. You see it more in premature children than in full-term children. But it's just a matter of it not being strengthening and strong enough to stop things from refluxing. I think that we're seeing it more now because we see more children that are born earlier than we did before. Wait.
Does phosphorus have anything that connected with that? Phosphorus.
So, phosphorus in what form?
I don't know. I just
It sounds to me like phosphorus should neutralize acid.
I
So-
just take Tums for
Right.
keep the phosphorus down, levels down. I don't even know what phosphorus is.
You have kidney disease?
Yeah.
Okay. That's more to keep it down so that it doesn't damage your kidneys. Yeah. And calcium binds with the phosphorus. That's why you get the Tums.
Okay.
So it's binding with it so it won't do any damage. Yes?
I was gonna say, I know I've been thinking that, it's not over the time medicine, I've been thinking it for a long time. But is it a time where, that you've been taking it for so long, and it doesn't work, and, when maybe the doctor has to stop it, or you stop it?
I've seen people have to change brands, change types. Often people are on both the proton pump inhibitor, that's like the Prilosec, Nexium, whatever the other one is, Prevacid, and the H2 blocker. So they take one in the morning and one in the evening because they need both kinds of protection in order to battle their symptoms. But I think just like with anything, if you're taking medication for a problem and and you're still having the problem, then that means you got to revisit the person who prescribed it and say, this is not working.
And then you say coffee, and you know, I gotta talk about my coffee.
Yeah.
Coffee,
Yeah. Yeah, coffee, caffeine, chocolate, anything that tastes good. Yeah, just forget it.
Okay, she was saying the coffee, but you were saying that some of the teas are not good for you. So how do you identify which one would be good and which one wouldn't be?
So tea in itself is not bad, caffeine is bad. And so black tea has caffeine in it, and green tea has caffeine in it. So you would have to stick with the herbal teas, and that's if you're drinking the tea to avoid reflux. Okay? If you don't have reflux, drink your tea and your coffee, because it's okay. But if you're having reflux and you're wondering why, except for pasta, it needs to be cut off. But yeah, so the herbal teas, like, you know, my husband drinks dandelion tea and chamomile, and I hesitate to say peppermint tea because to me it's kind of a contradiction, but they say, you know, it's good. So, but those teas are okay.
Can mustard be used to help calm it down a little bit?
Ooh, I don't know. Have you tried it?
I mean, I tried a little bit and it did seem to help.
Then it works. We're going to add that to our home remedies. Mustard. Yeah.
Get a job, mustard.
Mm-hmm. But if it works. Yeah. Okay. You know, because mustard's a natural thing that came out the earth. That's why. Yes, sir.
Zyrtec help your allergies.
Pardon me?
Zyrtec help your allergies.
Yes. Very much so.
That's the best one to take.
It can be. So I would say the reason to take Zyrtec is it is allegedly non-drowsy, and I say allegedly because of all the non-drowsy ones, that's the one that makes the most people drowsy. And so that's why when you're on Zyrtec, people tend to say take it at night, whereas you could take an Allegra in the day, or the other one, Claritin. Yeah.
What you do with it, take the medicine and you read all the side effects.
Don't read it.
Now that's your doctor.
And no, I'm saying, honestly, okay, I'll say it this way. Don't read it alone, okay? Read it with your doctor. Read it with someone you trust that has medical knowledge. I can't stand that the pharmacist gives those things with every single thing of medicine, because then I have people, oh, well, how'd the medicine do? Oh, I never took it because I read that thing that came. Well, that explains why your blood pressure is still 200 over 110, you know? So, and if you decide not to take it, please just inform your doctor that I'm not going to take it. Because we be thinking we did something. Ooh, I gave them this medicine, they coming back, I'm going to see success. And then y'all walk in and haven't done anything we said. And we don't know what's going on. So, you know, you could, these days you could send a message. You don't even have to talk directly to them. You just send a message saying, not taking medicine. Bam. Yes?
Do you find that when a lot of people lose weight, they feel on their own that they just stop this medication, that medication, and then it affects them because they haven't consulted the doctor about it? Even though you say weight is a big factor, a lot of people just think, because I lose it, then I cured everything.
Right. And you know, to be honest, when you lose weight, you can come off of medicines, but I prefer that you do it like, you know, under some supervision, and so somebody can tell you which ones to stop at which time. And I always think that if you make too many changes at once, you don't know what worked. So if you come off all the medicines and then you start having some symptoms, well, which one was it? You know, so yeah. But I always encourage people to lose weight to get off of medicine. That's like one of the motivating factors for a lot of people, is they don't want to take the pills no more.
Can you shed some light on what's called diabetic stomach?
That's the one that's called gastroparesis. And so because of diabetes, then the peristalsis, or the food does not move through your digestive system as well as someone who is not diabetic. So it's not being pushed through to the intestines, you know, and out. And so they have to give you medicine to kind of stimulate the movement of that. All righty then. Let us go forth.